8 symptoms of pancreatic cancer seniors should never ignore. There are moments when the body whispers before it screams. For many seniors, especially after the age of 50, small changes in health are often brushed aside as just aging. But what if those subtle signs were something far more serious? Pancreatic cancer is known as a silent disease, often detected too late, not because it gives no warning, but because those warnings are easy to ignore. This is not about fear. It's about awareness, care, and giving yourself the best chance to act early. Because sometimes, noticing one small symptom can protect years of life ahead. If this message feels important, take a moment to support this channel. Subscribe for more simple, life-saving health guidance like this video, and share your thoughts in the comments. Your small action today could help someone else notice a warning sign tomorrow, and that truly matters. Persistent abdominal pain that does not go away, especially in the upper part of the stomach, should never be ignored in older adults. This type of discomfort often feels like a dull ache that may slowly spread toward the back. Unlike common digestive issues, it does not fully improve with rest, simple remedies, or time. Some doctors warn that when pain becomes steady or keeps returning over days or weeks, it may be a sign that something deeper in the body needs attention. The pancreas is located deep inside the abdomen, which is why pain from this area can feel hard to pinpoint. It is not always sharp or sudden. Instead, it may feel like pressure, heaviness, or a constant burning sensation. Many seniors mistake this for gas, acidity, or even normal aging. However, research shows that pancreatic-related pain often becomes more noticeable after eating, as the organ is actively involved in digestion. Another important detail is how the pain behaves over time. If it gradually worsens, spreads to the middle of the back, or begins to interfere with daily comfort, it should not be dismissed. Some patients report difficulty sitting or lying down comfortably because of this deep, internal ache. This pattern is different from temporary stomach upset. Healthcare professionals often emphasize that early attention to unusual, persistent pain can make a meaningful difference. Ignoring it may delay proper evaluation. Any abdominal discomfort that feels unusual, lasts longer than expected, or changes in intensity deserves careful medical attention. Especially after the age of 50, unexplained weight loss without any change in diet or physical activity should always be taken seriously in older adults. While some may see it as a positive change, medical experts often view sudden or steady weight loss as a warning sign that the body is not functioning as it should. When weight begins to drop without effort, it can indicate that the body is struggling to absorb or use nutrients properly. The pancreas plays an important role in digestion by releasing enzymes that help break down food. When this function is disrupted, the body may not get the full benefit of what is being eaten. Some doctors warn that in certain cases, this can lead to gradual but noticeable weight loss, even when meals remain the same. The body may begin to lose muscle and strength along with fat, leading to a weaker overall condition. Research suggests that this type of weight loss is often not sudden in appearance, but becomes clear over weeks or months. Clothes may start to feel loose, energy levels may drop, and physical stamina may decline. These changes can happen quietly, without causing immediate alarm, which is why they are often overlooked. Another important factor is that this weight loss is not linked to lifestyle improvements, such as healthier eating or increased activity. Instead, it happens without clear reason. Healthcare professionals often advise that any unintentional loss of weight, especially after the age of 50, should be properly evaluated. Paying attention to these changes can help detect underlying issues earlier. When the body begins to lose weight without effort, it is often a sign that something deeper needs careful attention and timely medical review. Yellowing of the skin and eyes, often known as jaundice, should never be ignored, especially in older adults. Even a slight change in color can be an important signal that something inside the body is not working properly. This yellow tint usually appears first in the whites of the eyes and may slowly spread to the skin, becoming more noticeable over time. This condition often happens when there is a buildup of a substance called bilirubin in the blood. Some doctors explain that this buildup can occur when the bile duct becomes blocked, preventing normal flow from the liver. In certain cases, a tumor in the pancreas can press against this duct, leading to this blockage. Because of this connection, jaundice is considered one of the more visible warning signs that should prompt immediate attention. Other changes may appear along with yellowing. Urine may become darker than usual, sometimes described as tea-colored, while stools may turn pale or clay-like. These changes are often linked to the same underlying issue affecting bile flow. Research suggests that these combined symptoms can help point toward problems in the digestive system that require further evaluation. Many seniors may assume this is a temporary liver issue or a minor condition that will pass on its own. However, healthcare professionals often stress that waiting can delay important diagnosis. When yellowing appears without a clear cause, it should always be checked. Recognizing this early and seeking proper medical guidance can make a meaningful difference. Changes in skin or eye color are not just surface-level concerns, but important signals from within the body that deserve careful and timely attention. Loss of appetite that appears suddenly, especially when favorite foods no longer seem appealing, should not be ignored in older adults. A healthy appetite is often a sign that the body is functioning well, so when interest in food begins to fade without a clear reason, it may indicate an underlying problem. This change is not simply about mood or preference, but can reflect how the body is responding internally. The pancreas plays a key role in digestion, helping the body break down and absorb nutrients from food. When this process is disrupted, eating may start to feel uncomfortable. Some doctors warn that individuals may feel full very quickly, experience a sense of heaviness after small meals, or develop a quiet aversion to food over time. These subtle changes can slowly reduce overall food intake without being immediately noticed. Research suggests that a reduced appetite in seniors is often linked to changes in digestion and metabolism. When the body is not processing food properly, it may naturally begin to resist eating. This can lead to a gradual decline in energy levels, muscle strength, and overall health. The body may not receive the nutrients it needs, which can weaken its ability to function normally. Another concern is that this symptom can be easily dismissed or misunderstood. Many older adults assume it is a normal part of aging or a temporary phase. However, healthcare professionals often emphasize that a lasting decrease in appetite deserves attention, especially if it continues for several days or weeks. Recognizing this change early and seeking proper medical evaluation can help identify potential issues before they become more serious. Appetite is closely connected to overall well-being, and any unexplained loss of it should be taken seriously and addressed with care. New-onset diabetes that develops later in life, especially without a clear family history, should not be overlooked. In many cases, blood sugar levels begin to rise gradually, and the condition is treated as a common form of type 2 diabetes. However, some doctors warn that when diabetes appears suddenly in older adults, it may be linked to changes in pancreatic function rather than typical aging or lifestyle factors. The pancreas is responsible for producing insulin, a hormone that helps regulate blood sugar levels in the body. When this organ is not working properly, insulin production can become irregular or reduced. As a result, glucose begins to build up in the bloodstream. Research suggests that certain pancreatic conditions can interfere with this process, leading to the unexpected development of diabetes. What makes this symptom concerning is that it often appears on its own, without other clear warning signs at first. Many individuals are prescribed medication or advised on diet changes, and the focus remains only on controlling blood sugar. While this management is important, it may not address the underlying issue if the pancreas itself is affected. This can delay further investigation into the root cause. Another important detail is the timing and pattern of diagnosis. Healthcare professionals often note that when diabetes develops quickly, or when blood sugar becomes difficult to control despite treatment, it deserves closer attention. These patterns can sometimes signal that the pancreas is under stress or not functioning as expected. Recognizing new-onset diabetes as more than just a routine condition can help lead to earlier evaluation and better understanding of overall health. Any sudden change in blood sugar levels later in life should be carefully assessed, ensuring that no deeper concern is left unnoticed or untreated. Changes in stool that appear unusual, such as a greasy texture, pale color, or stools that float more than usual, should not be ignored in older adults. These changes may seem minor or even embarrassing to discuss, but they often provide important clues about how well the digestive system is working. When stool begins to look different from its normal pattern, it can signal that the body is not processing food properly. The pancreas plays a vital role in digestion by releasing enzymes that help break down fats, proteins, and carbohydrates. When this function is affected, the body may struggle to digest fats effectively. Some doctors explain that undigested fat can pass through the digestive system, leading to stools that appear oily, bulky, or difficult to flush. This condition is sometimes referred to as fat malabsorption and is an important sign that should be evaluated. Research suggests that these stool changes may develop gradually, making them easy to overlook at first. A lighter or clay-like color may also appear when there is an issue with bile flow, which works closely with pancreatic enzymes in digestion. These subtle differences can point toward deeper concerns within the digestive system. Many seniors may feel hesitant to talk about bowel habits, assuming it is a private or uncomfortable topic. However, healthcare professionals often emphasize that these details are medically important and can help identify underlying conditions earlier. Ignoring such changes can delay proper diagnosis and care. Paying attention to digestion is one of the body's natural ways of revealing internal health. When stool changes become noticeable or persistent, they should be taken seriously and discussed openly, as they may be an early sign that the pancreas is not functioning as it should. Constant fatigue and weakness that do not improve with rest should not be dismissed as a normal part of aging. While it is common for energy levels to change over time, there is a clear difference between occasional tiredness and a deep, ongoing exhaustion that affects daily life. When the body feels persistently drained, even after proper sleep, it may be signaling that something more serious is happening internally. The body relies on a steady balance of nutrients and energy to function properly. When this balance is disrupted, energy production can decline. Some doctors warn that conditions affecting the pancreas may interfere with digestion and nutrient absorption, leaving the body without the fuel it needs. As a result, individuals may begin to feel weak, slow, and unable to carry out even simple activities without effort. Research suggests that this type of fatigue is often described as a heavy, lingering feeling rather than normal tiredness. Tasks such as walking short distances, preparing meals, or maintaining daily routines may start to feel overwhelming. This gradual loss of strength can reduce independence and overall quality of life if not addressed early. Another important aspect is that this symptom can easily be overlooked or explained away. Many seniors assume it is due to age, poor sleep, or temporary stress. However, healthcare professionals often emphasize that fatigue, which continues for weeks without improvement, deserves careful attention and evaluation. Recognizing persistent weakness as a potential warning sign can lead to earlier understanding of underlying health issues. When the body consistently feels low on energy without a clear reason, it is important to take that signal seriously and seek proper medical guidance without unnecessary delay or hesitation. Frequent upset stomach and repeated vomiting, especially when it happens after meals, should never be ignored in older adults. While occasional digestive discomfort can occur for many reasons, ongoing symptoms that return again and again are not considered normal. When the stomach remains unsettled for long periods, it often suggests that the digestive system is struggling to process food properly. The pancreas plays an important role in helping the body break down food through the release of digestive enzymes. When this function is disrupted, food may not move through the digestive tract in a smooth and efficient way. Some doctors warn that this can lead to feelings of fullness, nausea-like discomfort, and repeated vomiting after eating. This happens because the body is unable to properly handle the food intake, causing irritation and digestive imbalance. Research shows that when digestion is affected at this level, symptoms often become more noticeable over time. Meals that were once easy to eat may start causing discomfort, and the stomach may feel constantly heavy or unsettled. In some cases, vomiting may occur shortly after eating, leading to reduced nutrition and gradual weakness in the body. Another concern is that these symptoms are often mistaken for simple stomach infections or temporary food-related issues. Many seniors may assume the problem will resolve on its own. However, healthcare professionals often emphasize that persistent vomiting or ongoing stomach upset should always be evaluated, especially when it continues beyond a short period. When the digestive system repeatedly shows distress signals, it should be taken seriously. Ongoing discomfort and vomiting are important warning signs that the body is not processing food correctly, and timely medical attention is essential to understand and address the underlying cause. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.